The need for the fourth ring was as much to do with the fact that there was multiple transmissions at the same time rather than it just being the UK strain.
There were different elements, but clearly, as Jerome's pointed to, we had an explosion in the number of exposure sites. It got out to almost 40. Almost 10,000 people who are primary or secondary close contacts. When you've got that many people potentially exposed, you cannot afford to see cases pop up out of those exposed individuals who then have contacts with 20, 30, 40, 50 people. You need to make sure that if cases arise in those close contacts, that they only may be exposing their family or their household.
Coburg situation where you did have contact in a very condensed room amongst multiple people, and we didn't see, just with the UK strain, there was no nebuliser involved. How did that play out then with it when it's just on the back of that virus in terms of spreading exponentially amongst the community?
I mean, it was still a significant transmission event. It tells you that when you're inside, when you're in close contact, when people are talking and there for a time indoors, there are a number of people who can get exposed and develop illness. But if you can get ahead of it through those rings of control, because all of those, as soon as that transmission event was identified, all of those individuals were quarantined, they were tested, their close contacts were identified and so on. So that brought it under control, essentially, but it's not over yet.
Sorry, what's the fourth ring?
So the fourth ring is the circuit breaker as another protection.
The cluster hasn't gone beyond the second ring.
The great dilemma of public health and our great frustration is that when something doesn't happen, you get the accusation that you've done something that wasn't necessary. We don't know what might have happened in an alternative universe without all of the things that we have put into play here. But I'm sure the accusation would have been there that we should have gone earlier or we should have done a circuit breaker if we'd seen cases emerge in these casual exposure sites or in these multiple locations where people were exposed. Masks have almost certainly stopped some transmission that would have occurred otherwise. The actions of people to test and to quarantine, knowing that they were at those exposure sites, I'm sure has made a difference.
You say that you have to be cautious when you don't know what you're dealing with. Now you do have experience dealing with it. Same action apply if you have a similar set of circumstances, or does the fact that you now have more evidence mean you be more cautious?
We will always be cautious, but the confidence that we have in the performance metrics of test, trace and isolate are really reassuring. But every single circumstance on its merits. We will get cases where we've got this freedom of movement again, where someone will have been to an indoor setting with lots and lots of people, and it might have been, it might be a place where hundreds of strangers come into contact with them. That could be a profound challenge. So, we never rule out tools that need to be used if that's what's required to get to zero again. But I do think if it's a single case, if there are limited close contacts, that test, trace and isolate and those three rings can do the job the great majority of times.
Brett, do you believe you'll need state of emergency for another 9 months?
Well, we know that the state of emergency allows me to have the power to quarantine people who are international arrivals. Without that state of emergency, there's no international arrivals into Victoria. So it's not to say that the state of emergency being in play means that there are public health directions that are broadly applied in lots and lots of areas of our lives. They will only be applied where they're required. But that's one key element that is clearly an ongoing requirement until we get that very substantial vaccination coverage.